One of the leading causes of untreated mental health conditions in South Africa has been shown to be stigma, misinformation, and fears of discrimination. Social rejection and job losses has led to many South Africans suffering from mental health conditions that remain untreated. Joining us now is Professor Renata Schoeman, who is the head of healthcare leadership at the Stellenbosch Business School. Prof, good to have you. Thank you very much for coming on this afternoon. What are the mental health conditions that generally people in workplaces, maybe even in academics, don't like to talk about for fear of being stigmatized?
Well, but most conditions people are not comfortable talking about, but especially anxiety, depression, substance use disorders. I think people are more willing to speak about things like ADHD, but the big conditions they are more reluctant to talk about.
Yeah, and is this because the employers themselves don't have enough information about these conditions, or even fellow employees not having enough information about these conditions that would lead, as opposed to those suffering, to be able to share broadly about what they are experiencing?
That definitely plays a role, but there's also a concept of self-stigma. In other words, how I myself as a mental health patient understands my condition or view my condition and also think other people will perceive it. For example, you might think it's a weakness or a defect in yourself or poor parenting or whatever the case might be. And then often that leads to people not seeking the necessary support, but it is born from a lack of knowledge, lack of awareness, and then the fear of discrimination. But yes, definitely colleagues and leaders might not know enough, and people might also use words very freely like, oh, I'm so depressed today, when they're not depressed, they're having a bad day, which then means to the person that really struggles from depression, I should just man up, I should just be stronger, this is not a real thing because other people can pull themselves together, why can't I pull myself together? So it's a vicious cycle where people use terminology too loosely and then thereby take away the reality of the suffering of people that really struggle with mental health conditions.
Yeah. Now, in the space of healthcare, particularly in a business environment, I suppose the first thing would be how protected I am, or how protected should I be in a business, for example, against such discrimination?
Yeah, we do have legal frameworks in South Africa. If we look at the Employment Equity Act, it says very clearly that they can't be discriminated on any grounds, and that would include a mental health condition. It's no different than a physical health condition. So there's many legal frameworks that is protecting people struggling with mental health disorders. But what is even a bigger role is the organizational culture and the role of the leader. If there is a culture where it's safe to speak, where leaders are courageous and vulnerable to also speak about their own mental health difficulties or struggles or stress that they experience, the employees will be more comfortable speaking about it. And when you have a culture of safety and openness, it's way easier than come to the fore, reach out when you need support. And also then where employers are willing to provide the support. And the support does not mean we have to provide internal services necessarily, but to make it possible for a person to visit a healthcare professional, to visit a clinic, and not say, oh, but you must take unpaid hours for that few hours to go and see someone that can potentially to assist the person to stay functional at work. Because if we don't do it, what happens is people are then booked off from work, or that we have an increase in absenteeism and hospitalizations, or you can have people that's not doing well, they're at work, but they're not really present, and therefore sub-performing, and that is what we call presenteeism.
Yeah. How can organizations internalize that culture of openness, internalize that culture of employees being able to share this openly?
I think the number one is it's a top-down approach. As I mentioned, it has to start with the leaders. It's not the HR department's responsibility. HR often can play an important role. But firstly, the leaders. Secondly, is to have a culture of where we educate ourselves and raise awareness. Get professional people to come and talk or listen to a webinar. People have that staff discussions amongst them or educational activities. That is very important. And it doesn't have to be in-house. Once again, there's many professional people that will be willing to get involved and to really be spokespeople. Yeah. But then what is also very important, that there are identified people that we know as a safety person at work, and it's often not HR, it's often a trusted colleague, maybe a more senior person, which is not necessarily even a team lead or in a leadership position, but someone that people feel comfortable to speak to. And I think it's very important that we get that SOPs in place of this is the report person, but also then, what do I as a colleague do for the people around me? Instead of just seeing a person always come late and say, oh, he's always late, they must be lazy or can't he plan better? To find out what is happening, maybe a spouse passed away, or it's a single mom having to struggle with children in the morning that create additional stress, but reach out and have the conversations and see how we can support each other, because you never know when you're the one that needs the additional support from your colleagues.
Yeah. I could be making the same mistake that employers are making here by just sensationalizing this particular aspect of things. But the fear is always that this can lead to a lack of productivity if you are suffering a particular condition. How true is that, and how do you navigate that particular aspect?
It is very true. But I don't say that in a negative way. It means that there's a solution, there is hope, there is something that we can address. If someone is depressed, they can struggle to concentrate. If someone has a substance abuse problem, they are maybe not well rested, they might have after effects the next day. If someone has a sleep disorder, and chronic sleep deprivation can affect your ability to concentrate and function, and also anxiety and untreated ADHD. However, there's effective treatment. So if we then identify someone, and also there's an onus on the employer on the employee to reach out for assistance if you need it. But if you then get the necessary treatment, whether it's psychotherapy or whether it's a combination of psychotherapy and medication, you actually can function with medication at work. There's many leaders and many professional people that has been diagnosed with mental health conditions. If we think there's a 30% incidence of disorders in South Africa, people are treated effectively, they're on medication, they're on work, you might not know it. So I think part of this is the perception that we have of medication negatively affecting people. Sometimes there's side effects, but in general, it optimizes your functioning and improves your functioning. So we need to get away from this perceptions of how we perceive someone. How does someone look that have mental health disorders? We don't know. We can't see. And often it's people that's highly functioning that you would never have guessed, but that there's effective treatment available.
Yeah. I suppose the takeaway key message from this conversation, Prof, should be whether it is the patient themselves or whether it's the leadership in an organization, professional diagnosis should be encouraged, and it should never be a case of a tick box exercise to see like, oh, you're lacking concentration, tick, you are not active enough, tick, you're always tired, tick, and therefore you have anxiety. No. What you're saying is encourage that employees and employers themselves go for professional diagnosis of their condition.
Absolutely. And Darwin, just the last maybe comment from my side. Over the past couple of years, we are very happy and relieved that organizations and employers are starting to have the conversation about corporate mental health. But I am worried that the pendulum has swung over, where employees consider it only the employer's responsibility to look after yourself or after you, and that employees do not take the responsibility to look after themselves and also to seek professional support and be compliant with treatment plans and interventions.
Prof, appreciate your time. Thanks so much for coming on this afternoon. That is Professor Renata Schoeman, Head of the Healthcare Leadership at the Stellenbosch Business School. We turn to this now.